Hi, Steve here again. I wanted to do a video on the wet market, which I will do, but before that I wanted to relay a little bit of background information on China's reaction to this pandemic versus China's reaction in the past. Now in 2002 there was a pandemic occurred, another bat virus that came out of China, and it was SARS virus, and it was a killer. And China acted in an exemplary manner. They immediately reported, brought in the World Health Organization, provided samples. They were able to track this virus back and whatever, put inhibitions on international flight and whatever, and by the time the whole thing was over, there were only 800 deaths in the entire world from it. So a tremendous success story. And much of it due to China's involvement, so they did very well on that. But now we have this COVID-19 virus, and there's a little different response. Now, if I were in the government, I'd say, hey, we did something terrific in 2002, worked just fine. Let's repeat that. Let's jump on that bandwagon again. But they didn't. They took a tact where there was lying, withholding of information, samples not taken, samples destroyed. Certain scientists were not allowed to talk about this or work on it. Even now, a new law passed that if there are any papers done on the origin of the COVID virus, they have to be cleared and censored by the government and the military before they could be published. So it just makes you wonder. It appears that the origin of this virus is something that needs to be or wants to be kept under wraps. So we have that response that is so different than SARS with such devastating effects that I thought, well, you know, maybe the viruses are different. So SARS and COVID. If a person has SARS, they will infect 3 or 4 people. That's called the RO number, or the R0 or R0 number. The number for the flu is 1.3 people, so if I have the flu, I can infect 1 1/3 persons, and then those persons go out and infect an additional 1 1/3, and it compounds that way. With SARS at 3 to 4, if I infect 3 or 4 people and they infect 3 and 4 people, that compounds quite rapidly. They used to think that COVID was about 2.5 was its number. It's been recently revised where it's almost 6. So now we have something that can really spread. I can infect 6 people, those 6 infect 6, and away you go, and this thing blows up. If anybody wants to compare the flu to COVID, just give them those 2 numbers, 1 1/3 and 6, and you can see the difference. So the death rate, SARS is a real killer, about 10%. COVID, they really don't know because they haven't tested as much, you know, but it's looking down there in single digits, you know, 1%, 1/10 of a percent, 2/10 of a percent. They'll figure it out, but it's not 10%. The incubation of the 2 viruses are similar, 2 to 7 days for SARS, 5 to 12 days for COVID. Where the 2 viruses really differ, though, is in how many carriers they produce that are asymptomatic. Now, SARS, most of the spread was close contact in with hospital workers and whatever, because it had to be fairly close. And the people that got SARS, only about 13% of them were asymptomatic. And asymptomatic, as we know, are people that walk around, they don't know they have it. They're shedding the virus, they're infecting their 3 or 4 people, and on and on and on. And it perpetuates itself in that manner. Now with COVID, they think the asymptomatic rate can approach 80%. So that is a huge number. New York Times just recently published that they feel that when the very first person showed up sick at the hospital, that there were 10,000 actual cases out in the city that were these asymptomatic ones. And there you have people walking around for days and days infecting their 6 people at the subway or at the movies or in restaurants or in the markets or parks, wherever. So this allows it to spread way out. And then I think you could see in Wuhan where it started that if that was the case where you had this unknown spread, that you can have your international flights, somebody flies to Italy, seeds down Italy, you know, somebody from that seeding flies back to Wuhan and reseeds down Wuhan with a different strain of it because it mutates when it goes. So there's a lot of confusion about the strains in there, but that's why you have the strains all different and in different places. It doesn't mean that it was not Wuhan where it first started. First case, first death, first epicenter, first quarantine. So bats, lab with the biggest bat collection in the world. You get the picture. So when we look at that, how does this explain the different response that China has to this pandemic versus the successful 2002 one? And what it is comes down to 2 questions. One's answered. Where did this start? Started in Wuhan. You can argue that, but nobody's arguing that. Started in Wuhan. But the second question is, and the important question is, where did it start? And there's only 2 answers to that. It either started in the wet market. You know, the other place is that lab. Now, if it were in the wet market and a natural source, a natural progression like SARS was, like Ebola is, like MERS was, where they could take those samples and track that down. They could track the SARS down to the very cave where the bat lived that originally had it. So they're very good at that. And they could do that with COVID too, but they weren't allowed to. That process was stopped. No samples taken, no samples destroyed. Scientists told to keep their mouth shut. Even now, a paper that talks about the origin, as we said, of COVID has to go through the censoring process with the state. So if it's in the lab and a natural source, that puts it in with all these other naturally occurring things. But if it's not in the market, if it's in the laboratory, that's a different set of things. And if that is the case, then maybe this response has something to do with not wanting anybody to be able to prove the wet market one way or the other, because it leaves plausible deniability that it was maybe the lab. But the thing is, it didn't arise in both of them at the same time. It came from either the market or the lab. So if you prove that it was not the market, you don't have to prove anything here. It's just the only other answer. So I think all of those things churning around for China, and if it would be the lab, the condemnation that would occur, and man-made virus, you know, and one of these viruses is the animal passage type, so it's indistinguishable from the natural mutation type. A lot of problems possible. So why don't we think about that a little bit? We'll talk about the wet lab next time we talk. Have a good night.